Hi, I'm Beth Boynton. I'm a nurse consultant and author of the book Confident Voices, The Nurse's Guide to Improving Communication and Creating Positive Workplaces. These nurses and nursing students are getting ready to participate in a pilot workshop about interruptions. In nursing, there is a paradox about interruptions and distractions. On one hand, they alert us to new information or problems that can be life-saving. On the other hand, they break concentration, increase stress, and contribute to mistakes. Finding a healthy balance is crucial and challenging. The nurses and students agreed to let me film them doing an improvisational activity called overload. We experimented with the activity 3 times, each one lasting about 2 minutes. These excerpts reveal powerful teaching moments about stress and safety. Here's what it looks like.
Last year, 12, 16, 20.
When our concentration is compromised, it doesn't take long for even simple tasks or simple questions to become difficult. Watch how hard June and then Carla work to answer, what's 5 plus 2? Or what's your favorite color?
24, 62, 66, a MacBook Pro.
What's 5 plus 2?
7.
Let's see. 16, 20, 24, 28, 32. Blue. Things that we do that require.
Did you notice the sound effects in the second clip? Anytime Carla would pause or make a mistake, a phone would ring, an IV pump alarm would go off, or a patient would call asking for help. Can you relate to this situation? Can you relate to her increasing stress? I sure can.
Ding, 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 IV alarm.
1963. 20, 24, 28, 32, 36.
Nurse, I need help.
What color are your shoes?
Just look.
Do you have any children?
That many.
6 times 8?
Let's see. I totally lost where I was.
How hard is it to concentrate?
It's very challenging. I'm not even doing my math like I'm supposed to be.
So brainstorming questions.
One of the brainstorming questions I asked the group was, when do nurses need to concentrate?
Almost all the time unless you're on your lunch break.
In my case for oncology, we kept doing calculations for the oncology drugs. We have to do the weight, the height and weight, and then there's a formula that you use to the height and weight and divide that to get their BSA, and then you multiply that by a certain formula for each drug. So each drug is different.
Everything we do is urgent to someone. Let's take a closer look at what it's like for nurses during a nursing minute.
Nurse, quick, my wife fell out of bed.
Dear, he's pulled that Foley out again. Can you help me, please?
Hey, you better get in there. That colostomy bag needs to be changed before it bursts, and we have a problem. Excuse me, how do I get to the gift shop? And do they have daisies? Not roses, daisies. Her room is very dull and needs some color.
Nurse, what's taking so long? My mother's screaming in pain.
Supervisor, we have a call on line 1. Mr. Reyes' blood sugar is only 53, so it's really low. Don't give him anything, only juice with sugar. Then we check it in 15 minutes. And will you call me?
Could you please call the kitchen? I did not get my coffee today.
When we look at medical errors in hindsight, the interruptions and distractions tend to become invisible. We hear stories about nurses giving the wrong medication or surgeons cutting off the wrong leg, and we wonder, how could this happen? If we don't look at the whole work environment, it's easy to see how we could conclude that the nurse or the doctor is stupid or careless. Yet in reality, oftentimes there's not enough staff, there's not enough time, and there's too much noise to get the job done properly. What's exciting for me about being a facilitator in interactive workshops like these is that I get to help nurses see themselves as smart and compassionate professionals who utilize sophisticated skills, knowledge, and experience to provide service under extraordinarily challenging workplace dynamics. In the course of their learning, they gain insight and respect for their own and each other's limits. If you think about it, it's actually the opposite of horizontal violence, which is one of the issues that plague our workplaces.
80, 84.
80 minus 5.
Is 75.
Do any of your kids want to be nurses?
No. Can you believe it?
I believe that we will be more successful in making healthcare safer once we get at some of the underlying dynamics of human behavior that leads to the dysfunction in the systems that we're in now. Assertiveness and respectful listening, positive relationships are some keys to building a healthy workplace culture, but they're much more complicated than meet the eye. In my book, Confident Voices, I explain these underlying dynamics and use activities, real-world stories, discussion, and reflection questions for teaching and practicing new behaviors.
I'm sorry.
I'm so grateful to the nurses and nursing students who participated in this workshop.
18, 52, I don't know, whatever's on sale.
2 times 3.
6.
How much overload is this causing?
I'm just glad it's a test.
I know she had a little bit of trouble mirroring.
Yeah, trying to
I
get
tried
all
slowing
those-
down too, and then I started mirroring her. Did you see that?
We had some great discussions and a lot of fun. I hope that this YouTube will stimulate more dialogue among nurses and consumers, physicians, about interruptions and other workplace issues that nurses face. I think that collaboratively we can create safer healthcare and more respectful work environments for nurses.
Just constantly checking in with yourself to see how you think your day is going and what you need to do differently. And we're getting a lot more irritated.
Yeah.
Yes.
Just shoes, just look at it.
It's frustrating.
I ask them to ask for what they need because it's easier for me than to have them guess or maybe wonder if their needs will be met. This way the communication is better and they trust you more.
The IVs in their wrist, a lot of people are moving their wrist around and somehow, just the way they're moving their arm where the IV is, it just creates whatever sort of back pressure.
If the needs needs of the resident are met up front. You know, if there really is a fire in the building, that would be a kind of a positive interruption.
There is such a thing as interrupting yourself. You go to give a patient a medication and you tell them what it is and what it's for, and they're like, I've never taken that before. So you go out, you lock the med card up, you go down to check the order, you go to check and see, is this a new medication for them? Is it a new name? So you interrupt yourself, but you have to do that because you want to get it right.
Yeah.
Interruptions can affect what you're thinking and concentrating on. So I used to walk up to the med nurse if I needed to ask a question and just stand there. But the problem with that is they'll finally will turn around and go, can I help you? Which is an interruption in itself.
As a student nurse, interrupting a nurse, I don't know if something at this point is really important or not, so I feel like I have to almost say something or interrupt.
We're good with this one. So.